Well, good afternoon. We want to thank you guys for tuning in today on this very special edition. I am Guy Danhoff with Missouri Healthy Schools, and we are here with Dr. Ashley Krause, who is the Associate Superintendent for the Farmington School District. Ashley, this is part 2 of our interview. Last time we talked about the WISC model. We're going to continue that today, but if you didn't see last week's episode on Thursday, we actually have a link right here on Twitter. And even in this broadcast, if you go to the show notes, you're actually going to see the link for the first broadcast where we really talk about how Ashley feels that she was prepared for COVID-19 using the WISC, as well as we talked at the end about re-entry. I know she's like kind of cringing when I use that word, as I'm sure all kinds of emotion is spreading right now through that part of the phase. So with that, Ashley, I kind of want to take us back to the very, very beginning, back in November when I met you. You also talked about this certainly last Thursday, but you had said, and you repeatedly have said, the WISC model has to start with your why. And I was wondering again for our viewers, if you could share why that is the cornerstone and the most pivotal piece of getting started.
Sure. So again, knowing your why or finding your why, it's a baseline for us in this district, regardless of what position that you're in. If you're in leadership role, if you're in the cafeteria, if you are wherever you are, it's a foundation of where we start. And if you can self-reflect, and if you can then project out why you do what you do, then we find that we have a better understanding in moving forward and being able to set goals and to achieve those goals. So we find it extremely important. We'll put it on our agendas. We will start by reminding ourselves in our norms for each meeting or leadership or professional development. What's your why? Find your why. Why are you here and why are you doing what you're doing? So the WISC model, when you look at it, it defined when we looked at our health and human services and moving forward with some actions we needed to take in the district. It was our why.
Sure. And with it, I want to follow up with this only because it resonated with our viewers from our last interview. I think it goes just one step further. I really, this is obviously something that you've done, and you call it the table talks, the kitchen table talks. Because I think if you just say, just know your why, I think everyone would say, well, that's kind of a cliche. Yeah, I get it. But follow up with that part of it, because I think that's what really gives the fuel that it needs for that kind of that transformation to begin to take place.
Sure. So that kitchen table talk time was pretty much coined in my household. And that was the time when mom would bring you to the kitchen table and discussions would happen. And sometimes those discussions were down and dirty discussions where you got vulnerable. So it just seemed natural to have those conversations when you sit there in a leadership group and you're trying to strategize, and when you're just talking and you're not vulnerable with one another and moving forward with change, it's very superficial. So if you can get to a point where that trust is within that team and you can storm and norm and you can disagree with one another professionally and come out on the other side somewhere in the middle, that's what we try to do. That's what we try to emulate. And with that, sometimes that means you have to have kitchen table talk time, which right. Every administrator knows when you come in and you have leadership time and we say, okay, it's time for some kitchen table talk time. Everyone knows time to get vulnerable, time to trust one another, and time to point out some things that maybe we didn't do as well as perhaps we could. And it's time to make some changes.
Yeah, I do appreciate you sharing that. I know that's the third time I've heard it, but I think if we didn't mention that piece of it, I don't think, people see the attraction of how powerful that model then becomes because of, again, fueling it through that kind of honesty and transparency. Yeah. So with that, let's kind of shift gears now. Let's talk about pick up from last week on Thursday's interview, and let's go straight into the health and wellness policy discussion. So I'd like to know, and I think everyone would like to know in these current pandemic times, where are you guys at in terms of implementation of your local wellness plan?
So we actually we had met twice this year already, and we were gearing up. We were very excited. It was the final draft of our actual strategic plan that we had set forward. So like I told you before, this is our second year. And from the very beginning, we started to model our health and wellness policy or health and wellness plans and committee work after the WISC model. It just seemed natural to us, so that's where we started. So we missed our third meeting, but we house all of our information in Google, and we have a Google Classroom, and so we communicate with those community members by email. So what we've done is we're able to virtually send out the information and say, you know, here's where we are. Is this still agreeable with our plan? Which I assume that when I get that community member response back, there's going to be some things that change. We've already adjusted that strategic plan based off COVID. So with that being said, you know, we are at the point where we're starting to collect data. We have recently looked at the school health index model to help gauge and assess ourselves as to where we're supposed to be. So as far as the policy goes, I think we put a little bit of a halt to it, sent out a second draft to say, okay, now this is what we said. Now that we're going through this, what needs to be added or eliminated? What is now a new priority or a top priority?
Well, it's nice so that you're able to use the WISC model to, again, anchor in that framework. So with that, let's continue with the data. This is kind of picking up from where we last off in our last interview. And I think when you start getting to that data discussion, you know, how did you determine what data you were going to collect first?
So when we, part of that connection with the why is going to your community, your staff members. And again, remember, we pulled in team members that represent what we felt, or we reached out to say, what component do you believe that you match up with? So every component was represented. And in the beginning, we recognized very quickly that we didn't have family engagement in there. We didn't have as much community engagement in there. So we fixed it and we invited more people to our table to talk. So again, it's ever changing. But with that being said, our community told us in the very beginning, we believe you have two problems. And the two problems that they said we had was behavioral and mental health needs, not enough services, not enough supports, and not enough identification, and substance abuse. And that's been a long-term indicator of some problems within our community and our schools for, you know, as long as I've been here, for 25 years. And so with that, or 26. So with that being said, we started there. And when you start with those two pieces, that is a little bit different than just gathering health information from, you know, the nurse's office on what are your chronic visits versus your, you know, chronic diseases. So we had to look uniquely at data that we already were collecting. So when we would go to the nurses with this, we would say, you heard what the team said, you heard what the community said. We have two problems. So let's start to train ourselves in data collection in those areas. And what does that look like? And for that, sometimes you have to go, you know, you've got to go into some strange places that you've never been before. So we started researching other states, and luckily Missouri had passed, you know, some statutes on, you know, suicide awareness and intervention. We started looking at what are the best screeners for that, because when we went into, you know, mental health and behavioral health, we had a lot of students that were making suicidal threats. And with that, you have to do some assessments. Well, you don't just bring in your counselors. You've got your social workers, you've got your SROs, you've got your director of safety, you've got your nurses, you've got all those different people that you can bring in that WISC model to talk about those screeners. And we collect data off the screener. So I think the data that we initially started to collect, again, different, was to meet our two priority needs that our community said needed to be solved.
Right. Okay. So with that, really, to me, it begs the question then, you know this, it's not a cliche. I think every organization struggles with this. We know that communication is the key. Therefore, the question I want to ask is, what were your communication strategies specific, especially when you're pulling in all these groups you just mentioned, so they feel like valued and part of the process and not threatened, like, okay, why do you want this data from me again? And seeing that bigger picture. So how did you educate them, and certainly even discuss how the data would be used and or collected? So, because that's an important piece of this. So how did you go about getting that communication?
So again, as we have Google Classroom, it allows us to have one hub for that entire team.
Okay.
So when I would send out, a newsletter, or I would send out a document and I would say, take a look at it, we did a lot of professional development. We met monthly. We would meet in isolated pockets, but then come together. Now, in the beginning, we only met together. And then we would begin to split apart and then come back together again. So in each of those pieces of professional development, it was very important to, again, come back to the why or the purpose, and that's just one piece of data collection with what we use with that screening tool. But for instance, a nurse is going to look at that in different ways than a counselor. A counselor is going to look at that in different ways from a social worker. A school resource officer and a director of safety are all going to look at those in different ways. We trained all our coaches in that because we went the physical, the physical education and health component of how do we teach kids about, behavioral health and mental health. And it's in the curriculum, it's embedded in the curriculum, but if everybody doesn't know why you're doing what you're doing,
Right.
then you have a problem. So I would say communication, regular meetings, regular phone calls with one another. And even during this pandemic, we've continued those,
Right.
Google Meets and getting with one another to reevaluate what the roles are and how we're going to continue to support our staff, students, and community.
I tell you what, Ashley, I think that's one of the most powerful things I've learned from spending time with you and trying to understand this whole process of some of the success and even hurdles and challenges that you've talked about before. But that communication piece, that transparency piece, and being so honest with all those different entities, if you would, is really seen movement there right where you're at in Farmington. And I certainly so appreciate you taking the time with us on really giving your insights as to the WSC model. You're also just the transparency of what you are, just telling it like it is. I mean, I think that's what we all want to hear, right? I mean,
Yeah.
so here's my kind of last question. And this one's kind of easy. My other ones I don't think are so easy, but this one's sort of on the easy side. So let's just say you're a school district and you're willing to kind of get involved in this this leadership discussion regarding the WSC model. Where would you point them to get started?
So when I first got into this, you have to understand that I don't necessarily have a background in any of these areas. I am a special education teacher at heart. I have, a doctorate in leadership, and I don't have all those, big areas within the components. So what I did was just start researching, and the first place I started was actually with the state of Missouri. And if you are able to dig in and you go to DESE, and I do remember seeing, to this day, 2 years ago, seeing Laura Beckman's name. And just when you work with curriculum as an associate superintendent, you see math, you see social studies, you see science, you see ELA, you see the fine arts. When I went into this physical education and health site, the manner in which she had everything set up foundationally was so easy for me to navigate. And all the information was there. And bam, there was that WSC model again. And every place I went was the WSC model and the visualization of it, and then the organization. So I would start there. There are links to, ASCD and CDC. And I think, we mentioned the Sophie, webinar series, and then all of a sudden, the next day, boom, pop, it's on there.
Right.
And so through those conversations, I know Sean Neville's is now taken over that as Laura has moved into the other role. You can look on that site and it'll give you other resources and other places to go. It's such a beautiful guide if you don't know what you're doing to stair step you through supports. And they're very willing to pick up the phone. They're very willing to answer emails. And that's what I noticed right away is just how human and passionate the state of Missouri is on this movement going forward. And that's what you need. You need passion. You need that integrity. That's where you start. Start with your state.
Sure, and within that, I kind of want to point this out then. You got groups like MoShape, certainly on the health and
Yes.
PE side, nationally Shape America. You've got these groups that are working so closely aligned in resources and professional development, those kinds of things. And then even with us here at the Missouri Healthy Schools,
Yes.
as you've recently seen, during the pandemic, and I actually want to get your comment on this because during the pandemic, he's talking about Laura Beckman, she asked the question of like, how can we get more involved in an actionable way? And what she decided to do was to look at, okay, using the WISC model, what needs need to be addressed? And one of the things she did was reach out to the Missouri PTA and their president-elect, Carla. And one of the things that we discovered was there were some things that parents are very concerned about. You actually talked about this in our last interview, and two of those things happen to be getting healthy snacks
Yes.
and certainly getting adequate recess while you're stuck at home. As
Yeah.
you know, this group here has put on weekly shows for now 6 weeks. This week will be our 7th. And we have the Stuck at Home recess shows
Yes.
with Spaker Spot and Sean Evels,
Yes.
as well as Lisa Farmer does an amazing job, certainly on the nutrition side, with her healthy snacks. And I was just curious from, again, your position as a, high-level administrator, what do you think about groups providing these types of resources during this pandemic?
You have to have it. And if I'm a huge Twitter fan, and that's how I learn. So I get up every morning at about 4:30. Now, it doesn't mean I'm functional at 4:30. It just means I have my coffee and I sit there, and that's my time to look for about an hour and scroll through Twitter and have a little bit of fun and learn. Quite honestly, it's how I learn. And through other people and networking. And what I'll say about Mo Shape and Shape and all the different the girls that are out there doing these wonderful things with snacks and activities, they have passion. They're
Yep.
fun, and they enjoy what they're doing. They believe in what they're doing. And again, that just goes back to that model.
Yeah.
You must find someone that has that about every single one of those components. And when you have somebody that has that passion and that intensity about that component, that's who you bring to your health and wellness policy committee meetings.
Right.
Because you won't leave without some crazy garden being grown for the nutrition portion of it. You won't, and they'll figure out how to do it. And when you get those passionate people, all you do is sit back and you watch those people do what they know what to do. I mean, it's amazing. And they are the ones that are doing it. You're just there providing, the coffee in the morning. That's all you're doing. And you provide the structure and the means and the way in which they get there. But again, through these organizations and the communication and just looking at the promotion of learning and networking, it's amazing. And if you can become a constant learner with that, I mean, you can't lose.
Right. Well, and then one last little caveat to that. What I found most amazing about both those shows is that they are both anchored in the WISC model. I've had the privilege to interview both of them. And what's really amazing is all, again, anchors to that WISC model, which is so awesome as you see these folks so passionate, so wanting to deliver high value to the parents, to the kids, to the students, to the community. And it's, again, all embedded in that WISC model. So Ashley, I just want to say thank you so much for taking the time with us. This has been a very fun and certainly very informative and educational time together, especially as you kind of break down these different components and moving pieces to the WISC model. I'm kind of glad you went kind of deep on the data part, because I know that's the language certain people love to, they hear through that, filter, if you would. And so with that, I want to tee up what's going on this Thursday for you. I'm real excited that this Thursday at 2:00, you're going to be going live on a webinar series sponsored by Sophie. For those who may not know, Society for Public Health Education. As I know you're doing something in conjunction with the CDC. In your session, I have to read this. Sorry, I want to make sure I get it right.
Yeah.
Is leveraging local school wellness policies to support the whole child. And to let you guys know, we've provided a link, again, embedded in the description of this video, as well as you can go to our Twitter or you can go to MoShape's Twitter, and you're going to find a link that you can register, something you have to register for. It is free. So actually, I'm asking very nicely, could you give us a little sneak peek of what you're going to be talking about on Thursday?
Sure. And the CDC will be prepping with the structural components and a lot of resources to tee up so that you can get your committee going, because again, it could be a little bit of a dry topic if you just say, oh, we're going to talk about a policy model.
Right.
They'll give those portions. Excellent partner, Caitlin, And then I'll move into the actual practical, so kind of boots on the ground, practical ways in which you can get this going within your district and have a starter. We'll end it up kind of talking about where we are in our process for reopening and the considerations that we're taking
Right.
as we move forward. And again, no final decisions made right now, but as we're watching things play out, how we will utilize our emergency operations plan, incident command model, and partnership with the WSCC to be able to reopen somewhere along the lines of the continuum for each child.
Right. Well, we're certainly looking forward to it. I know I am, and those a lot of other people are as well. Ashley, want to thank you so much for your time. For Dr. Ashley Krause, I am Guy Danhoff. We want to thank you guys for watching part 2 of our interview series right here with Missouri Healthy Schools. Thank you.